morning. It's Sunday, August 7th, and today's rant affects us all. I say that with certainty because we all go to the doctor. I know that all of us go to the doctor. And many of us have plans which just involve a copay, so we know we're going to pay $5 or $10 or $20 when we go into the office. But if anything beyond that happens, we really don't know what it's going to cost. So, if you had to have an MRI, did you know how much that would cost? No, because the medical profession has never published that information as they were required to do in an act that was passed in January of 2021. My word never is a slight exaggeration. The results from the previously implemented hospital price transparency final rule was put into effect, as I said, on January 1st, 2021. But now, a year and a half later, only 14% of the hospitals are in compliance with that rule. The hospital transparency rule required hospitals to publish standard charges for all their services and items to make the prices for the 300 most common services accessible in a consumer-friendly format. So now, 18 months or so later, we have had additions to the transparency final rule. And maybe somebody's going to soon let the public know how to get the pricing and whether or not it's even understandable to the general public. Because many of these prices involve many things that we don't understand. Because we're not medical professionals. We don't understand how long it takes to do an MRI, how much the equipment costs. There's many factors involved in treating a patient. So I don't know what's going to happen when these rules finally come out into the public domain, which after many delays happened on July 1st, 2022, but it's still not out there available for the general public. Now, this new rule called the Transparency in Coverage Final Rule was issued by the Centers for Medicare and Medicaid Services, CMS. It requires health insurers to disclose the pricing for covered services and items. And insurers must include the rates they have negotiated with the participating providers for all covered services and items, as well as the allowed and billed amounts for out-of-network providers. And these amounts are the maximum rates insurers will pay for a given service. And billed amounts are what providers have actually charged. Now, many of us never know what this is going to be until we get the bill. I know that's what happens in my case. I go to the doctor for a checkup or something. He bills $400 to the insurance company. They pay their portion, which I never know what it is. They pay their portion. And then sometimes I have to pay. And sometimes I don't, because the $10 copay that I pay, or the $5 copay, covers some of this stuff. So that's all I'm supposed to pay. But medical billing is a mess. And my understanding of the documents that we are going to be receiving are really going to be legible by using your laptop or your phone, because these documents, these price lists, are in a computer format, because there's so many different pieces, and you will need a piece of software to interpret the price list. That's as much as I can tell you right now. And it seems like we, the public, are getting screwed, because why can't there be a booklet handed out by your provider or by your insurance company? I know I get something from my insurance company every year, and it gives a list of all the different things that it's covering for me. But nowhere in there does it say this is $30, this is $40, this is $50. That's not there. They just say they're covering these things. And covering is a vast desert. We do not know what's out there in the desert. And even if we get the pricing and we compare the pricing, are we, as a patient of a doctor that we really like and have trusted for many, many years, going to go someplace that he has not recommended to save a few bucks? Or are we going to use this price list to negotiate with our doctors and say, look, you're sending me to X and it's going to cost $1,000 when I could go to Y and have the same thing done for $500? Are we going to put the doctors in that position? Are they going to have to defend where they send us, who they're working with? I don't think this is really a workable situation. I do think it's important for us to know and understand the pricing and be able to ask why X is better than Y and why and why and why Y is more expensive or less expensive than X. Do we want to be put in that situation as a consumer? I don't know. I mean, you trust your doctors. You've gone to them for many years. They've taken good care of you. Why are they being put on the spot like this? I guess they're being put on the spot because we, the public, have been screwed by the hospitals. Because their pricing has no relation to what things may cost. And let's face it, hospitals have to make money. They are a business like any other business. And that means that they do not necessarily have the best interest of the patients at heart, because they have to make enough money to pay the staff well and to take care of the patients. And maybe they are overzealous in the pursuit of the dollar to keep the business running. And so I know that having this price list is a good idea. But this is not an ordinary price list. This is not bread and eggs and things like that. This is medical treatments involving experts and expensive equipment. So I'm not sure we're going to get what we really need from this price list that's supposed to be issued soon. But I leave you that to think about. Think about your doctors and think about what they charge and think about whether you think you're being treated fairly. Have a great day. I'll see you in the morning. Bye.